All right. So we're going to start now, and we'll hopefully this year be doing more of these, that after services, we'll do for about 45 minutes a conversation about different topics after the high holidays. But this one seemed particularly urgent, starting because of two things that I thought this would be a good thing to do. One, for those of you who don't know about the situation on the Upper West Side, there's been a very big explosion because a lot of homeless folks have been put in some private hotels around the city. We're going to hear more about that. And the Lucerne Hotel, I think that's on, is that 79th Street, Eric? Is that
79th in Amsterdam.
79th in Amsterdam. Eric's organization, Project Renewal, folks from those shelters because of COVID couldn't be in the, here we go, Bella, we're not talking to you. The need to spread people out. And there's been some reaction against the folks in the Lucerne Hotel. That's exploded in some of the synagogues and in the Jewish community and many of our members on the Upper West Side. So Eric and I started talking about this a few weeks ago. And then I thought, you know what? This would be a larger, important conversation to have. Because in New York City, we are certainly seeing an explosion of homelessness. And there's a lot of questions people have. And we now have, there are 114,000 children in New York City, homeless kids in the public school system. That doesn't exist, I think, anywhere else in the country at that level of, and so I thought, well, you know, we have in our community two leaders in homeless issues in New York City. Sorry about the dogs. And why don't we bring them to an Oneg and start a conversation? I don't see this as being the final conversation CBST is going to have about homelessness. In fact, I think I see this as the beginning because this is a very serious issue here in New York City, and all of us need to understand it better, figure out how to be supportive of everything that moves towards solutions. But it's not as simple or an easy issue. And so I've invited these two great people, longtime CBST members in the leadership as well as everywhere. Lisa and Eric have both been members of the synagogue forever. Lisa, weren't you once the newsletter editor even? I remember back in the day we had a newsletter.
We actually had a paper newsletter that was mailed out.
And I had to hide behind the columns in Bethune Street because Lisa was always hawking me because I was always...
Rabbi, I need your column. I need your column.
I know. So anyway, we go way back there. And Eric has been a longtime member and was a president of the synagogue. And Lisa is now on the board of the synagogue. So how great that we have two people in our community who can help us understand better these complex issues. So let's start with you, Lisa. And would both of you, before you talk about the issue, explain what your organization is and kind of what it does so that we who are not in the know can know better. And then why don't you tell us also a little bit the history of homelessness in New York City and a little bit about the issue itself. And again, if you have questions, put them in the chat.
Hi, everyone. Shabbat Shalom. A special Shabbat Shalom. I'm seeing people's faces and names who I haven't seen in at least 6 months. And it I don't know, somehow I didn't realize how much I missed everybody. So it's great. I'm so glad to be connected. I'm the Senior Vice President over housing and residential services at an organization that is based on the Upper West Side called The Bridge. And I'll explain a little bit more, but currently I oversee almost 1,500 formerly homeless individuals with severe disabilities, mostly mental illness, who now live in our housing programs. Our organization, besides the housing services we offer, we provide outpatient treatment services. So we have a clinic, and we also have community-based treatment programs, ACT teams, and other services that actually go out to the community and meet individuals where they are, where they're living, whether they're homeless or housed, and try to provide them with the mostly mental health and medical help that they need. So the bridge has been around for about 60 years now. And although, so Eric's organization is much more involved in the current situation, I thought it would be really important to talk about the history of homelessness in New York City, because a lot of people don't know it. A lot of people, like myself, moved here in the 90s or even later. And almost in any urban area, there is this history. And I think that it helps people have some more empathy to know the history of who these people are. They are people. And as irritated as we are about their presence in our neighborhoods, it's important, really important to know who they are as people. So way back in the 1700s, when this country was first starting to be established, there were families who had members with very severe mental illnesses. This has existed, mental illness has existed throughout time. And many of them had symptoms so severe that their families couldn't care for them. They couldn't really live safely in the community. So the insane asylum was created, and that is what it was called for many years. And we've all seen lots of movies and heard a lot about insane asylums. And after time, as this country grew, there were more and more and more people, just general population. So then that increased the number of people with serious mental illness living in New York. At some point, the states and the federal government took over responsibility of caring for these individuals, providing care for these individuals. And all of a sudden, there were these huge state hospitals where folks with severe mental illness were being sent because there was no treatment at the time. Their symptoms could not be controlled in any way at the time. They had delusions, they had, hallucinations, really, really difficult stuff. So at its peak, in the early 1960s, New York State had almost 100,000 people living in state psychiatric hospitals. And that's just the state system, not the private asylums that wealthy people were able to send their folks to. Anyway, in the 1950s and then into the 60s, medications were discovered by happenstance, but they were discovered. Medications were discovered to help the most severe symptoms that people with severe mental illness were suffering from. And it actually calmed them and enabled them to be more present and to be more controlled. And then also there was Freud and talk therapy, which was really starting to be accepted. And all of a sudden, everybody realized that keeping people in these huge state hospitals was cruel and now unnecessary, because with their medications and therapists and psychiatrists, they could probably live in the community. So actually, President John F. Kennedy was the first one to sign legislation, and then it continued therefrom, that all of these huge institutions were going to discharge the psychiatric patients that they had back to their communities, because it was acknowledged that these huge institutions were terrible. So there was this very good intent, and this is often how policies work. There's a really good intent, right? Let's get these people back into the community, not living in institutions. Let's get them back into New York City, near where their families live. So what they did was they took all this money that was going into the institutions, and they said, let's put it into community-based healthcare. So these folks don't have to be isolated out here. They could be living and then getting their treatment and medications in the community. Unfortunately, the policy had a huge gap, a huge failure. The policy known as deinstitutionalization, which discharged all these people into the community, they put lots and lots of money into mental health clinics and services, but they did not really think or plan about where they would live, right? These people had been living in institutions for decades. They actually often had no connections to their families, their communities that they came from. And so when they were discharged back to New York City, they had nothing. They had perhaps, if they had been helped, they had some disability benefits. Many had nothing. And in New York City at the time, there was also this, in the 70s and 80s, there was a time that many of you know where people fled from New York City, right? There was this white flight. Families were moving into Long Island and Westchester and even New Jersey because they didn't want to be in the urban areas where things were going downhill. There was no money for the city. We were actually in bankruptcy. There were all these empty buildings because landlords fled. But there were these, what we call SROs, single room occupancy buildings, and flop houses, as they were called, where people didn't even have a full room to themselves. They had a little space and they had mesh over their heads. They had a bed and they would be able to afford to sleep in a bed those nights. But then all of a sudden, the boom came back, gentrification came in, and people are moving back to New York City. It's a cool thing to be an urbanite. And so all these SROs and all these flop houses, there were hundreds of thousands of beds available, affordable to these folks, gone. People bought up the hotels, bought up the flop houses, and turned them into co-ops, market rate apartments, everything that was unaffordable to the homeless individuals. So then, never before seen were thousands, tens of thousands of homeless, mentally ill people on the streets. So that's really the origin of how all these folks ended up on the streets. New York City, New York State, as Eric will talk about, has a right to shelter. So shelters started being created. But in any event, there was a huge homelessness problem in New York City. So there were some amazing, innovative social workers on the Upper West Side specifically, who came up with this innovative idea called supportive housing. And they pitched it to the government and they said, these folks need housing and supportive services in order to succeed, in order to actually live in the community. So let's put it together. Give us some government funding. We'll buy these empty, vacant buildings all over the Upper West Side, and we'll renovate them, and we'll place homeless, seriously mentally ill people in them. And it turned out to be an absolute genius solution, and it today is still the solution to homelessness. It has grown. Various models have been created. In my own organization, we have like 6 different models of housing. We have single sites where people live with 24/7 site on staff because they really need that. We have hundreds of people who we use our government funding to rent apartments out on the market, and then we sublease our apartments, and we have visiting case management services. in any event, this is the solution, but the demand continues to far outweigh the supply. And we therefore still have a huge homelessness problem in New York City. Estimates are that at least 75% of those homeless have a serious mental illness. So it is the solution. And because there isn't enough solution, we still are dealing with shelters and safe havens and street homeless individuals who need help. And COVID changed the entire landscape of everything. And that's what Eric is going to talk about.
Thank you so much, Lisa. It's so moving to hear you describe it. And for those of us who were in the city in the 70s and living on the Upper West Side, all those gorgeous brownstones that are astronomically priced right now, those were the SROs.
Yep.
Brownstones. I worked for a summer in 1978 in my junior year in college, between sophomore and junior year. I worked in one of those SROs on Edgar Allan Poe Street. What number is that? That's like, I forgot what number of street that is. In the low 80s. Every single brownstone between Riverside and West End Avenue, think about that. Every single brownstone between Riverside and West End Avenue was an SRO. People lived they were chopped up, and people like me, college students, but I didn't have a degree. I worked for social workers, helped out. We all remember what that was like. They were dumped. Some of it was the change in philosophy, but there was a huge lawsuit that some of us remember against that closed down Willowbrook in particular. Willowbrook was exposed. We remember journalists went in there undercover and exposed the horrific, disgusting, medieval treatment of these mentally ill people in Willowbrook, which was a state-run facility. It became a huge cause célèbre to shut down Willowbrook. But as Lisa describes, nobody thought through the deinstitutionalization of all of those psychiatric patients. Was not a thought through process. But the Upper West Side was a place that was full of folks, and that's why the Upper West Side was a very scary place in those years. In the 70s, walking around was a very uncomfortable place. And living any of those blocks between Riverside and West End, all of those gorgeous single-family buildings now housed dozens and dozens of formerly institutionalized folks. Thank you, Lisa. Thanks for that very much.
Absolutely.
And now, Eric, would you start by describing what your organization does? And maybe we'll actually give out information also for folks who want to follow up. But Eric.
So thanks. This is really great to be able to talk about this with all of you. So the organization I run is called Project Renewal. It was actually started in 1967, so 53 years ago, on the Bowery. Its original name was Manhattan Bowery Corporation. Its start was a novel model for treating the alcoholic men who are living on the Bowery. I think the term was the Bowery Bums. Probably is a musical written about this. But we innovated a non-hospital-based treatment program for alcoholics that had about the same level of success rate as hospitalization, but without the cost of the hospital. And so it became a very well-accepted form of treatment. And since many of the men were homeless, we also created a homeless shelter. Our first building is located at 8 East 3rd Street, so right around where East 3rd Street meets the Bowery. That was an old YMCA building, and today we still operate it. It's expanded now. It's a 175-bed men's shelter. It's also got a federally qualified health center and two different kinds of substance use treatment programs. And then there's another shelter around the corner that we also operate. And over the years, we've grown to be one of the city's kind of largest homeless service agencies. Today, we house about 1,000 people every night in 7 homeless shelters throughout the city, and another 1,000 people in permanent supported housing, exactly the same kind of housing that Lisa's organization runs. We also have a really significant medical practice. We deliver healthcare to about 13,000 homeless people a year. making us, I think, one of the largest providers of healthcare to homeless New Yorkers. And we do that through clinics that we've actually built inside our homeless shelters, but also in mobile medical vans that will travel to other shelters. That van actually goes to the soup kitchen at the Church of the Holy Apostles, where CBST used to be so many years ago. But when people come to eat, we deliver healthcare. And we also have some fascinating employment programs, one of which was started in 1995, is a culinary arts training program, which actually, it's a 6-month internship-based program that takes people with who are homeless or have a history of criminal justice involvement or are mentally ill, and trains them for careers in food service. And we ended up creating a social purpose enterprise called City Beat Kitchens, which today is a $10 million catering company that makes and delivers around 3 million meals a year to homeless New Yorkers. So I don't know if anybody is feeding more homeless New Yorkers than we are. So it's kind of a very comprehensive set of services that we provide to start with housing, transitional housing or shelter, then permanent supported housing, to provide healthcare, substance use treatment, and employment services so that people can achieve the maximum amount of independence that is possible for them. And one thing I want to add to Lisa's story about how we got here, in the last 10 years, just as there has been a realization that psychiatric hospitals were kind of cruel and inhuman places in many cases, we've also realized that our criminal justice system does the same thing. That we have put people in jail and essentially thrown away the key, or put them in jail, given them no help and no services, release them back to the streets where they immediately commit a crime again and are sent back and cycle back and forth. So there's a great values-based trend to decriminalize and to reduce the census in prisons. And in fact, there's a plan to close Rikers Island. And exactly the same problem that happened when we shut down these psychiatric hospitals is happening now as we reduce the census of people we put in prison. It's a great thing that we are not treating people as criminals just because they are homeless, but we have not provided or created the housing and services that those people need to avoid being in jail. So many people shuttle and cycle back and forth between the hospital, the streets, the jail, the prison, the hospital again, a shelter, a safe haven, the streets, instead of being provided the continuity of help and support that they need in order to recover. So these are the reasons why we have actually, these are two of the main reasons why we have a burgeoning crisis of homeless single people. There's also a completely separate crisis of homelessness for families with kids. And while many of the same factors drive that homeless crisis, it's also really just a crisis of housing affordability. There is no neighborhood in the entire city where a person who earns a $15 minimum wage can afford a 1-bedroom apartment. Not one. So our minimum wage is nowhere close to a living wage. And the minimum wage was raised fairly recently from an even less livable wage. So we shouldn't be surprised that we have the crisis that we have. So now let's talk about COVID-19. I think it was March 12th that the city kind of realized that we were in an absolute crisis and we had to go on lockdown. I had an emergency call with my senior staff and my board, and the question that I got asked is, so Eric, what are you most afraid of? And I said, my greatest fear was that this virus would rampage through the shelters. Now, a shelter has beds that are mandated to be 3 feet apart, but people live in large dormitories, sometimes 25 people in a room with beds 3 feet apart. You cannot imagine a more dangerous environment for this virus to spread. And part of the reason why shelters are so crowded that way is because it's very difficult to get any community to agree to having a new shelter. So shelters are crammed to the max because no one wants a new shelter. So my first fear was that this virus would absolutely run rampant through our shelters. My second fear is that it would do the same thing to our staff. We have 900 employees. About 700 of them cannot work from home, cannot just get on a computer and log on and talk to folks. They have to go to work. And since many of these people are among the lowest wage earners in the city because social service staff are not highly paid, they're taking public transportation, they're taking the subways, they're taking the buses, which at that time were breeding grounds, we thought, for the virus as well. And you also have to remember that at the beginning, you could not buy, beg, borrow, or steal a face mask. We, at the beginning of this crisis, had 75 N95 face masks for our entire healthcare team. That was the inventory. Pierre had a colleague in Hong Kong, and of course China had got the virus before we did. This colleague air-shipped 300 face masks to us as a donation because there were so few face masks available here in the city. So we had no treatments, no protective equipment, dormitories filled with people living 3 feet apart, and a staff that had no choice but to come to work. Let me say right off the bat that today, 6.5 months later, we have had 82 cases of COVID among our entire population of clients, only 82. We've had 2 people who died. Both of them were very sick with chronic illnesses. One of them was in hospice before they got infected with COVID-19. So I am huge, and we've had 31 cases among our staff, and thank God all of them have recovered and are back at work. But if you ask me how this happened, certainly all of the cleaning and disinfection that we did made sense. We staggered everybody's shifts so that they didn't have to come to work at the same time. We staggered meal hours so that we never had more than a few people eating in our cafeterias at the same time. But there's only so much you can do in this environment. The city first put up 500 hotel rooms for anyone who was symptomatic, because again, remember, there were no tests. If you had a fever of over 100.4 degrees, or if you were coughing or had shortness of breath, the assumption was you had COVID-19. And thank God the city provided hotel rooms so that anyone who had the slightest symptoms could be moved immediately out of the shelter and into those hotels. That was the first use of hotels. And then I think it was April, the city council proposed legislation that would have actually required the city to provide a private hotel room to any homeless New Yorker, period. So that would have been around 17,000 hotel rooms. Most of these are paid for, they're about 75% paid for by FEMA. It makes a lot of sense. It brings federal money into the city to support a hotel industry that was devastated. And it would have provided the physical separation that people need in order to avoid COVID. We were very involved in the negotiations around that legislation. And we were a little bit torn because I was a little bit torn because on the one hand, I knew that if we gave everyone a hotel room, they would be safer from COVID-19, but they would also be completely isolated from many of the services and social systems of support that they also need to recover from the reasons why they are homeless in the first place. So we advocated for a somewhat more nuanced solution in which we would have access to hotel rooms so that we could reduce the density of the population within our shelters, but still keep the shelters for people who we didn't think were going to function well in the hotels. And that ended up being the solution that the city adopted. But because there was so much pressure to move people into hotels fast, the city made a commitment that it would move 1,000 people a week out of shelters and into hotels. And that meant for my organization, because we had 7 shelters, that every 2 weeks, we had to empty or partially empty a shelter and move it into a building that we had never seen or knew existed 2 weeks before. And we did it once, and then we did it twice, and we did it 3 times, and 4 times, and 5 times. And we would get a phone call from the Department of Homeless Services saying, here's your hotel. Who are you going to move there? And you have, they actually pushed us to do it in a week, and we kind of would say we need 2, because in many cases, these hotels didn't have security cameras. There were all sorts of wiring changes that they would have need to make in order for us to be able to physically move people in. We also had to deal with our workforce. And I want to say a few words about the 900 people that work for us. As I said, about 700 of them really have to come to work in order to earn their living. And so at the very beginning of the crisis, again, no face masks, subways crowded. People came to work 3 shifts a day because they cared about the mission, because they wanted to keep their job, and they were grateful that they still had a job, since so many of their family and friends had lost jobs. Many of these people all of a sudden became the only source of income for their families. So they came to work. And then the racial protests happened, and New York City went on curfew, and the subway shut down at 1 in the morning. And we were all issued pieces of paper saying that we were essential employees, but the police didn't believe it. So our employees, who had been putting themselves at risk to come to work, now many of them were harassed by the police for trying to go to work during the curfew. One of our employees was taking the A train down the West Side for her shift, which started at midnight. Her train passed into the Columbus Avenue station. The police stopped the train, needed to see the papers from every single person on that train, pulled our employee off, decided that her paperwork wasn't good enough, and made her spend the night in the station, waiting for the trains to start up again at 5 o'clock in the morning. So these are the conditions under which our employees had been working since the beginning of March, when New York went on lockdown. And now they're changing their complete commuting patterns. So the 2 shelters that we moved into the Lucerne Hotel on the Upper West Side, as I said, they're both in the Bowery. So the employees who work in that shelter, some of them come from Brooklyn. It was not a bad commute for them to go from Brooklyn to the Bowery, but now they have to go every day all the way up to the Upper West Side to go to work. And so everything got turned upside down for our staff. And then think about those who have kids also and had to deal with childcare and learning from home while juggling their work as well. So that's kind of the backdrop. And now on about the first week of July, the city told us that it was now our last hotel. And we decided that we were going to empty these 2 shelters, one with 175 beds and one right around the corner with 108 beds. And we were going to move them and consolidate them in the Lucerne Hotel, because it was too difficult for our staff to juggle going back and forth from a hotel to the shelter. And so we moved all 283 of these men into the Lucerne. Now, because I live in the neighborhood, I live 5 blocks from Lucerne, I knew that there was one other hotel also being used to house homeless people. It's called the Belle Claire, and it's at 77th and Broadway. I knew that not because the city told me, but because I walked by it and I could tell what was happening there. So I was a little bit nervous when the city said, take the Lucerne, which is literally 3 blocks from the Belclaire. But we didn't have a choice, and we didn't have a lot of time. And so on July 27th, we moved, actually over the course of 3 days, we moved 283 men into the hotel. We notified the city councilwoman, Helen Rosenthal. We notified Gail Brewer. We notified Linda Rosenthal the week before we moved in, but the community didn't really know. And so while they had been a little bit queasy about, the 288 people that were living in the Belclaire, all of a sudden now there's 283 more. So there's almost 600 homeless people now occupying 3 blocks from each other, the kind of the beating heart of the Upper West Side. And this also happened at just about the moment that people were beginning to emerge from their apartments to gingerly start walking around the city again. Some businesses were allowed to open. Restaurants were allowed to, for the first time, have outdoor dining. As people started walking the streets, they noticed what seemed to be an incredible number of homeless people. They also made complaints about people urinating on the streets or defecating or masturbating, which are obviously pretty disturbing things to see. And so the situation has become this nightmare in which everyone is talking about the Upper West Side returning to the 1970s. Of course, most of the people who are saying that weren't even born in the 1970s, have no idea what was really going on in the 70s, but they have the mythology of it. What they don't understand is that today we have shelter and we have social services and we have supported housing, which is precisely the reason why it will not be like it was back then in the 70s. But there are also other things happening. Street homelessness has gotten worse, not better. And this took me a while to realize. I was not so sure, like I believed the public urination thing until I started walking around and noticed that actually I was seeing it also. And I thought, this is strange. This is not the people who are living in the hotel because they have the nicest bathroom they've ever had in their life. This is because there are no public bathrooms open. People who are homeless, they need a place to hang out during the day. And they're very good at finding places where their presence is not so noticed. Public library branches are a great place for people who are homeless to spend time. Retail stores that are big and crowded, you can go in and use the bathroom and no one really pays attention. The subways, some of them still have bathrooms. The parks had bathrooms. All of these bathrooms have been closed. There's nowhere to go to the bathroom right now. So all of these things have merged together to create this belief that New York City is completely and totally falling apart. And to make matters worse, at least worse in the perception, the 2 shelters that we moved into the Lucerne are for men who have histories of mental illness or substance use. And some of them are active drug users. So the idea that a respected organization was moving active drug users into the Lucerne Hotel, I think was the straw that broke the camel's back. And people felt that New York had become completely and totally crazy, out of its mind crazy. How could it be possible that we would be putting people into luxury hotels who are not safe? And this idea of safety comes back and back and back. People feel like it's dangerous. And that perception of dangerous comes from seeing behaviors that they're not used to seeing on the streets, like public urination, seeing street homeless, who they confuse with our clients who are living in the hotel, because it's not always obvious whether someone is sheltered in a hotel or sheltered in a shelter or an hotel or lives in supported housing or is actually living on the street. So there's a lot of confusion about who is who and why are they where they are. And then there's the fear of drugs and what drug users are doing. One of the real challenges of this is that everybody is safer when homeless people are living in shelters and not living on the streets. Shelter is not mandated. It's not prison. We don't lock people up in shelters the way we used to in psychiatric hospitals or in jails. So we have to attract people to come into shelter. The reason why people stay on the streets and refuse shelter is actually because their mental illness makes them not believe that they could possibly be safe in a different environment, but also because they feel shelter isn't safe for them. They feel safer on the streets. So we have to, or they don't like the rules. There's a curfew at 10 o'clock at night in a shelter. You have to come back or you lose your bed. There are good neighbor policies that say you have to behave in certain ways in order to keep your bed. But we don't kick people out of shelter for breaking the rules, because then all we'd be doing is putting them right back out on the streets. So part of what's so hard and so amazing about the work that we do is that we're balancing the need to attract people to come in off the streets and accept the services and the help that we are providing.
Eric, can I interrupt you for a second for a couple of clarifying questions that we're getting that I think would be useful?
Sure.
Because I think, so let's just clarify this. So there are different categories. There are people who are in shelters and then people in supportive housing.
Yeah.
Can you just do a little bit more to explain that difference?
Can I jump in? Or
Yeah,
All right,
either
Lisa.
one of you. So I think there's some confusion about those
Yes.
two things. You both said it, but can you just
Yeah.
give us a little bit more about that?
So supportive housing is the solution to homelessness. It is actual real apartments, right? So the government, instead of funding more expensive, huge shelters with people living in congregate settings, we have these wonderful buildings where people have their own apartments. They could have been homeless for a year or 10 years or 20 years, and now they're being afforded the opportunity to live in a building
So
with
that's
their
a
own apartment.
long-term housing
That
situation.
it is mostly considered permanent housing.
So it's supportive because you mean there are resources,
There are support
social-
services.
social workers and other
Yes.
social services.
Yes, the staff provide them with the support they need, mostly by linking them to community-based mental health services so that they're stabilized and they have a place to live.
So when we talk about the numbers in New York, what would you say the numbers who live in supportive housing? Can you say that? Do
I
you know?
think it's around 35,000, right? In the
Roughly,
state,
how
I
many
know it's
people are in all the
52.
different shelters every night in New York? Do we know?
Wow.
Oh, there are 17,000 single adults living in shelter. There are about 60,000 total people living in shelter. The difference between the 17,000 single adults and the 60,000 is families with kids.
We actually have a question about families with kids. How does that work? And what happens with where are families with kids?
So before I became the CEO of Project Renewal, I was the Chief Operating Officer at Women in Need, which is the city's largest provider of shelter for families with kids. Shelter for families with kids is different.
Can I just say something? Does everybody know what Eric did before he was at WIN? Eric, why don't you say what you did before WIN, before you started working in the...
Okay. I was a biologist. I got a degree in public health. I got my MBA because I didn't get accepted into medical school or a PhD program.
You got your MBA at?
Chapel Hill, UNC Chapel Hill.
So let's just, yep.
Okay. I was a management consultant in biotech for a while up in Boston. And then I got recruited by Colgate-Palmolive, where I was the global director of strategic planning for research and development. And I went overseas and I lived in India for 3 years running Colgate's supply chain operations in India, which I've subsequently joked was perfect preparation for running homeless shelters in New York. And I moved to New York from India.
By the way, let me just pause here to say that, first of all, Pierre and Eric are both amazing cooks, and I've been lucky enough to eat at their table. But one of the things that Eric got from his work was he's an amazing Indian food cook. I mean, amazing. We're talking incredible. While he was in India for those 3 years, he really learned how to cook Indian food. Anyway, I know it's not about the topic at hand, but an important one in our community.
Well, but also it gives me an opportunity to give Rabbi Kleinbaum a lot of credit because I went through a rough patch in between about 2000, actually between 9/11 and 2005. I was having difficult time finding kind of my place. And it was Rabbi Kleinbaum who suggested to me that all of this corporate experience I had about running large, complicated organizations would be really of value in the nonprofit sector where there are these increasingly large organizations. Project Renewal has a $120 million annual budget with 900 employees. That's a big company. So I ended up becoming the chief operating officer at Women in Need. And it was really Rabbi Kleinbaum who gave me this inspiration that I could take what I knew how to do professionally and put it to use in the service of an important mission in the community.
And I also have a similar experience. I started off as a corporate attorney, and I was representing huge companies and life insurance companies, and I felt horrible about the work that I was doing, but I had the skills and I tried to figure out what I could do with those skills that would actually help the world heal.
Yeah.
I just want to point out that Lisa and Eric, how moving that is to take the corporate skills that both of you had and through whatever means it happened to take these skills to apply them to this profound issue of humanity that we're facing. So I just want to give kudos to both Lisa and Eric as we start this exploration more. And I have a few more questions for you. Do you mind if I just throw some questions from our community here? Can you explain how the Lucerne and other hotels were they requisitioned? Did the hotels volunteer? Were they paid? Like, was this, like, how does that happen that a hotel like the Lucerne Hotel ends up, are they making money off of it? Is it a good thing?
So the city negotiated, when FEMA agreed that they would subsidize the cost of hotels, the city negotiated a master contract with the Hotel Association of New York. I think the contract is online. You can look it up. I think there's 179 pages for those of you who want to read it. I haven't and won't. I think, I don't actually know whether there are different rates for different hotels. I kind of think it's a standard rate. And I think that rate is around $120 a night. But hotel owners decide whether they want to opt in or not. Different owners have opted in at different times. So at the beginning of this crisis, we didn't have a choice. You know, you got a hotel and that was your hotel. And it became a little bit of a hodgepodge. And it's resulted in an incredible realignment of where homeless people are living, because instead of living in the neighborhoods that they were living in shelter, they're living in wherever there is a hotel for them that a provider was willing to use. One of the questions that people keep on asking about the Lucerne is, you know, because they believe that our clients are dangerous, and I'll talk about that if you want, because I don't think they are. People say, well, why don't you put them out in those airport hotels? You know, put them out by the airport. They can't bother anyone there. Well, the only problem is that there's no public transportation to get our staff to work at those airport hotels. And to the extent that those clients have programs and other connections that they need to maintain or that they work, they can't get to work from those places. So all of us really were looking for hotels that were logistically workable, big enough to accommodate the population we needed to house, and near subway lines so that our completely disrupted staff could get to work. And that's the reason why most of the hotels are actually in Midtown, because there are a lot of hotels there and they're easily accessible. And it has resulted in a real concentration of people in the city.
So, Eric and Lisa, I want to ask you something. Obviously, NIMBY, it's a bad thing, not in my backyard. But on the other hand, how do we deal with people who are drug addicts on the streets, doing the things that Eric talked about? We have the long-term solutions we're all fighting for. And by the way, I learned from Liz Shire. I think Liz is here with us tonight. Our beloved Liz Shire. She was the vice president of CBST. Then she fell in love and moved to DC. Okay, I did the wedding, but you know what? We love you, Liz, but Liz was really a very serious homeless advocate for many, many years. And I learned from Liz, and I do a donation on my credit card every single month to a homeless organization in New York City because I feel like, as a New Yorker, I basically should be paying another level of tax to those who are really dealing with homelessness. Because how do you make sure that not just giving a little cash to somebody on the street, but you're helping to solve the problem? There are organizations that are doing that. If you're so inclined, it can be a small amount, but do a monthly donation on your credit card as a New Yorker to a homeless organization that's doing good work is one way that we as New Yorkers, you know, who are compassionate, we're not Nazis, you know, we're not evil people, but what happens to our neighborhoods when we're dealing with, and somebody is writing in that in Harlem, there's apparently quite a influx, and maybe there are also shelters that are now housing, or maybe they're apartments housing serious levels of drug addicts who then, you know, buy lots of beer, sit on the street, make the street culture uncomfortable for us who are living in places. We're compassionate, caring people. How do we do it all? How do we, what can we do to be good New Yorkers and also feel safe?
Everybody, when the person passes you on the subway begging, or you come off you're walking by someone and they look so helpless and all they want is money, it actually helps keep them on the street.
Yes, yes.
You have to donate to an organization that is helping people.
That's what I learned
off the street, like Eric, like Project Renewal, and like The Bridge. We have safe havens for people coming straight off the streets, low threshold, very, very, you know, minimal rules to help them come inside. It's organizations that are going to help get them into housing. Throwing a dollar bill or a $5 bill into the hat, actually not helpful, even though it might make you feel better.
And you know, the substance use issue, it's a great question and it's an important question. But one of the things I've learned is that drug use is not a binary. You know, someone is not either not using drugs or a drug addict. There is an entire continuum of use. Some people use drugs socially, very rarely. Some people use them on a periodic basis, like once a week. Some people binge on drugs and then don't use them again for a while. Some people have highly chaotic use. And then, of course, there are people who are completely and totally addicted. And so just as there are so many different levels of engagement with drugs, and people move back and forth between these. So someone goes into recovery and does really well for a while, and then they have a relapse. So part of what we do is first of all, we stay connected. We meet with people in whatever phase of that they are. We don't judge them for their use or level of use. We simply try and get them to engage in less harmful ways of using through needle exchange programs, things like that. Or where possible, we get them to go into full-on treatment programs. We have a medical assisted treatment program. We have a non-drug detoxification program. We have residential programs. We have non-residential programs. But what I've learned is that there is a mythology about safety and dangerousness, which is not borne out by the facts. most people who are using drugs and are sheltered are far more of a danger to themselves than they are to anybody else. They are not interested in bothering you for the most part. And the crime statistics bear this out. I mean, it's interesting. On the Upper West Side right now, we're in constant contact with the 20th and the 24th precincts. And people think that there is a huge upsurge in crime that's driven by the presence of our clients in these hotels. And it's actually not borne out by the crime statistics. Crime in large-scale crime has actually been down over the past year, which may be because a lot of people have moved out or are temporarily not living here. But the kinds of categories of crime that you would associate or imagine to be associated with our clientele either haven't been going up, or they're going up because more people are on the streets. The police said, I was just in a meeting today, and the police captain said that their investigation into the robbery crimes and burglary crimes on the Upper West Side is not leading them to our clients in the hotels. There were.
We do have to say, Eric, look, and several people have said, and this, again, we're within our community, so we know our basic deep values. It's still unpleasant to pass people on the street who are urinating or defecating or shooting up on the street. Right. And these are complicated issues. It's not nice. It's not pleasant. It makes our living in the city more difficult. And so I think one of the things that we're talking about is also donating to these kind of organizations. But like for those in the Upper West Side or in Harlem, are there things that people can do concretely? Like do you accept donations? Can people volunteer? Some people have a lot more time now. Are there things that people can be doing as well? And then Liz Shire, I'm going to ask you if you want to say anything, because Liz has really been an advocate on issues around homelessness for many, many, many years, and she's joining us from DC. But let's hear from Eric and Lisa first about what can you say to people? What can we be doing? And I strongly recommend that people do a monthly donation. We can't be New Yorkers. I mean, we do our taxes, obviously, and we need to advocate for good policies. But for sure, I really believe whatever you can donate on a monthly basis, so you can feel walking around the city, you're doing something regularly, not a donation when you feel good. But it's part of it goes out every single month. We're in a city that's in a crisis. One of the questions that's come up in the chat, so are there any cities who are doing it better than New York? Or is it just that we're so big and we have this history? Like, is anybody doing it better here that we can learn from? Obviously, we don't have a healthcare system that's functioning as well, and we don't have but can you say that? Is there anywhere in the country that's doing it better than New York that we can learn from?
Well, I would say, and I think Eric can expand upon this, New Yorkers, New York City folks do not even understand how good it is here compared to other cities. Yeah. We have tens of thousands of people in shelters, unfortunately, because of COVID now sort of like really displaced. But we have tens of thousands of people who are off the streets and are in shelters where there are services. There's nothing like that almost anywhere else. You go to San Francisco, you will actually find 50,000 homeless people on the streets.
Yeah.
So Liz, would you like to say anything? And really, Liz, you're my inspiration around these issues, and I've learned so much from you over the years, and you've just been this dedicated person. And now Liz lives in DC, but a beloved part of our extended CBST community forever.
You're very kind. Thank you, Rabbi. Am I unmuted? Can everybody
no, we can hear you.
Great, thanks.
We can hear you.
So first of all, it's just so nice to see all of your faces. So thank you for this opportunity. Hi. So certainly DC is not doing it better. I can tell you that. We have a very large, I should say a very large population of insecurely housed people, which is a different thing, but also a large number of street homeless and very, very few organizations that, in my opinion, address their needs right. When I was in New York, I spent about 25 years in homeless service organizations. For the longest period of time, I was with the Coalition for the Homeless for about 17 years, I drove one of the vans for their mobile soup kitchen once a week. And that was a really eye-opening experience. I had the shortest route, the downtown route, and we served only about, depending on the time of year, 150 to 400 people. Most people in the summer, when people, as Eric spoke to earlier, who do not want to go into shelter for various reasons, don't. And then in the winter, a much smaller number of people when people got code blued in, excuse me, which is when the wind chill reaches a certain level, the police can, I may be phrasing this incorrectly, but I think actually arrest people into shelters, or at least bring people into shelters, whether or not they consent. So if certainly monthly donations to these organizations are great, but if what you have is time rather than money, there are so many organizations that could use your help. And a lot of these organizations have a lot of, say, school groups or, alumni groups or whatever it is coming in once a year. What they really depend on is regular volunteers who can show up at the same time every week or every month and just do the work, basically. And it's very hands-on. It's very directly with the people you're serving. So I'm a huge advocate for that. Think of the coalition. Yes, that's been the majority of my experience.
You asked how people, what can people donate other than money? Right now, well, first of all, the city gives us about $8 a day to provide 3 meals a day to our homeless residents. I don't know how many of you are doing a good job at feeding yourself on $8 a day. We certainly subsidize a lot more than that in order to make sure that our clients have healthy and fresh food. But one thing that is really helpful is people are bringing individually packaged snacks to the Lucerne. People always want to have snacks on hand, and we frankly use snacks as incentives to get people to come to programs, to show up for appointments. Into single ride Metro cards, packs like a 10-pack of single ride Metro cards, because our clients they don't have the money for the subway, so giving them a Metro card helps them get to an appointment or to work.
Eric, I'm going to just cut in for a second. I also want to acknowledge Rick Landman. I don't even know how many years Rick has been volunteering at the Church of the Holy Apostles Soup Kitchen every day, which serves 5,000 meals a week, I think, if that's correct. Is that right, Rick? It's just thousands of meals a week, and but right now I just invited Randy to talk a little bit about the issue. We've gotten several questions about the issue of homeless kids in New York City. And Randy knows a lot about New York City public schools and about the issue. I think it's 114,000 kids, homeless kids, are in the New York City public schools. The New York City public, what? 10% of the New York City public school system are homeless kids. So Randy's
by the way, only 25,000 of those 114,000 are kids living in shelter. And that tells you that what shelter is just the tip of the iceberg.
Yeah. Do you want to say something about kids in New York City public schools?
So this is part of why it's so agonizing that schools are closed or school buildings are closed, because for a lot of homeless kids, and why UFT, despite some of what our members are saying, are really trying to reopen schools if we can make them safe, because schools now provide breakfast and lunch for all of those kids, and for about, I would say, 60% of the kids that are in New York City schools. And the other piece, so we
is Grab and Go covering that now?
Grab and Go is covering that, but Grab and Go, the federal government's monies for all of the school-related food programs that are beyond just food to kids who are Title I eligible, all expire at the end of September. So it's yet, another one of the expiring issues, as the CARES Act expires. But so the UFT has spent a bunch of time with WINS, as Eric knows. We did a big project with WINS during in March or April, getting books to kids who are in the WINS shelters all throughout the city, so that they could have books at, so that kids could have their own home libraries. We've done a bunch of getting prom dresses to kids who are homeless so that they could go to proms. So we've done, and the New York City school system
You
has
need to be
done-
closer to the mic.
Sorry, has done a whole bunch of.
Nobody can hear you. Hold on.
Sorry. Is that, can you hear me now? It's just that it is a whole, it's the whole, the note and just like you're seeing the stories of people who are in minivans going to food banks, the precariousness right now, and I think Lisa said this before, of unemployment not being enough to cover rent, a job being gone. It's just, there is huge precariousness right now in the city of New York, and lots of issues and lots of things that were completely unanticipatable, where we just, so we don't sometimes, we can't find our kids who don't have, devices in shelters or don't have devices in wherever they are right now. At least with the wind shelters, we're able to actually make sure we know where our kids were. But it is a huge and growing issue in terms of the inequality in a place like New York.
Wow, so this is an amazing discussion. Can everybody hear me? We can hear, you can hear me? And it's now 9:35, which is later than we had planned to go, but Lisa and Eric and Liz, thank you for the contribution. And Rick Landman, also, we're not going to be able to get into this, but Rick wants us to know, and Rick has really been a hero since he retired from his day job. I got to say, we have amazing people at CBSE. Look at who we are as a community. We have a lot to learn from each other. But Rick has been a pro bono attorney in the Manhattan Housing Court, which is a whole other issue, right? About housing and the larger issue of how to have just affordable housing in New York City. We have shelters, supportive housing, and somebody just asked, what's the percentage of homeless who are facing issues around mental illness? I think you said it was 75%, is that correct? So 75%, we have to do some better solutions to this. And those of us who are living here have a lot of work to do. So this is the beginning of a conversation. We have never had quite this kind of discussion at CBST. And I just want to thank Eric and Lisa and Liz Shire. Thank you for joining us from DC. And all of you who have done something. And we all ache. We ache, and we also want to feel safe on our streets. And we don't want to watch people peeing on our streets. And we all feel that way. So for sure, we're all in this together. And some of us, I moved to the city in the 70s. And yeah, we're not in the 70s, but also New York has got a deep soul and a deep heart, but it's made up of people like who are on this Oneg right now. Eric and Lisa, do you have any final things you'd like to end with?
I want to say I was at the service tonight, and sometimes you read the prayer over and over and over again, and one day you see something in it you never saw before. So we were reading the prayer for our country today, and I picked out this one line. Help us to be humble in our fear, knowing that as vulnerable as we feel, there are those at greater risk, and that it is our holy work to stand with them. And that just completely jumped out at me, because of course this is a scary time, and of course it's scary to see someone who's not in their right mind, who might be using drugs, who's probably mentally ill, who might smell not so good, but really that person is at far greater risk than we are, and they do need help.
Yeah, I think for me, in tonight's service, what kept hitting home for me was please God, see me, please hear me. And I feel like most of us are heard and seen, and we're safe, and we have a warm place to live, and we have food on our tables. And there's so many people who don't, and it's just been so exacerbated.
I want to say, Lisa, I think we lost you for, I think we had a Wi-Fi issue with you.
Sorry.
We lost you for a couple of minutes, but I think your point is really an important one, and I want to end with that. Rick Tesler and Marty Pearl aren't on the phone right now, but when we were at Mauthausen, the concentration camp outside of Vienna, and we learned about how the Nazi guards would kick inmates over the edge of a quarry and just with laughs watch how they fell to their deaths. I said to Marty and Rich, I just don't understand how a human being can do that to another human being. And Marty or Rich, I can't remember which one, said to me, you know, by the time they got to that point, they were so smelly. None of those inmates had had a bath in months. They weren't wearing clothes that made them look like human beings. They were disgusting. And to those Nazi guards, they were less than human, not just because it was an intellectual idea. They looked at this collection of filth and didn't see them as a human being. And I thought to myself, how many times have I looked at somebody on the streets of New York and forgotten that that is a human being? That is a human being as equal as I am. How can I be critical of the Nazi soldier for kicking somebody when I walk by somebody? And I dedicated myself ever since then that I give money to organizations, and I do it as generously as I can, and I do it as regularly as I can, but I try and say hello. I try and look somebody in the eye. I try and say, when they ask me for money, I say, I don't have anything, but God bless you. How are you? I try to constantly remember that that is a human being. And God forbid I forget that. And that's our challenge, right? Because they're peeing on our streets sometimes. They're doing ugly things on our streets. They're drug addicts. They're blah, 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 blah. Well, guess what? That's how the Nazis also were able to treat us. Because by the time they got to a point, we were so ugly and smelly and disgusting that we smelled like the things that we see. This is our challenge. And I think in this new year, as New York confronts more and more challenges, and as Randy said, we have a president who wants to starve this city to death. And the people who will starve first are the people on those fringes that are these hundreds of thousands of homeless people. So thank you all. And as you get sunk by the reality of this issue, be inspired by the human beings like Liz and Lisa and Eric and Rick Landman who are doing something. We don't have to give up. We have to just say, okay, what's the piece you can do? Maybe it's only donating some money. Maybe it's figuring out, and Lisa and Eric are going to get a lot of emails. But we got to figure it out, folks, and that's what it is in this new year. And this issue asks us to light a light, to remember in every single bundle of clothes on a street corner covered in cardboard boxes is a human being created by God. No better, no worse than we are. So my dear friends, my beloved community, Shabbat Shalom. May this be a Shabbat that you find some blessing. Liz, we love seeing you. We love seeing you. Welcome back home. And thank you again to Lisa and Eric for giving your time tonight. And thank you for dedicating your life to this such important and crucial issue. And let's see this as the beginning of a conversation at CBST.
Thank you, Rabbi. And it was really great to see everyone. Shabbat Shalom.
Really great. Shabbat Shalom, everybody. Services tomorrow at 9:30. Yoga Shabbat. But we sent out an e-news that had a mistake today. I am not leading Yoga Shabbat. That is Rabbi Rapport. That was a mistake. You know that wasn't a Purim mistake, but it was a mistake. Rabbi Rapport will lead Yoga Shabbat tomorrow morning. Shabbat Shalom, everybody, and thank you again.